Okay guys, we're back. Just took most of the muscle mass off of the backside of this pelvic limb so that we could get down to the bones and we could start to work it and seeing where the bones work. One thing I want to remind you guys of is from here down is basically the same on the back leg as it is on the front leg. This is the superficial flexor tendon. This is a big part of the reciprocal apparatus. The reciprocal apparatus allows you to lift the horse's hock, and it'll pick up from the tip of the calcaneus, and it'll pull up right here, and at the same time the hock tips up, the foot will tip up. If you lower the hock down, the foot will tip down. So it's always best that when you're sighting a foot, especially a hind leg, you grab it by the hock, you sight down the cannon bone, and then you lift the leg, you lift the hock or lower the hock. That will raise the foot like this or lower the foot like this. You lower it until you get a side of the foot plate, of the hoof plate, okay? So, this is the pelvis. This bone is the femur. This is the largest bone in the horse's body, besides the skull. I think the skull might be close. You come on down the back of the leg, and the patella is here. The patella and area here is called the stifle, and it has 3 ligaments that run across the patella. You can't see those from the angle of the camera view, but there's 3 ligaments that run across the patella like this. Okay, sometimes that patella ligament, the medial patella ligament, will come unattached and it'll slip out of place right here. This patella ligament right here will slip out of place, and that's what's called upward patella fixation, also called stifle. To get the horse to get out of that state of stifledness is to startle him backwards so that his stifles actually straighten out and the patella ligament will pop back into place. Then they can relax and go back the other way. Okay? A horse that's got a stifle injury will drag the toe on that affected limb, and he'll drag it off. And we just looked at some horses' feet that were all dubbed off. That's the problem right there. Had bad stifles, so they dragged the toes off. Okay, so I said this is the superficial flexor tendon. This is the point of the calcaneus. You can't see the bone right now, but it's outlined right here. Superficial flexor tendon continues on. The horse has curve. There's a ligament that passes from here to here, and it's on the back of the calcaneus. So if you want to see if a horse has a curve, this is where it's going to appear, from here to here. Approximately a hand length down, and then about that long on the back of the tendon. Once again, from about this point down, everything is basically the same as the front limb. The 2 things that you want to remember that we covered before on a thoracic limb, the stay apparatus is a construction of tendons and ligaments and muscle bellies that will cause that horse to be able to stand rigid and actually appear to be sleeping standing up. The reciprocal apparatus, it will allow the horse, you can actually lock the stifle, lock the hock by bending that toe up like that and pulling the hock up like this. You can actually lock the stifle by locking the fetlock in the passer. Okay? We're going to just dive into this. We're going to take the bones apart from top to bottom and skin them out and hopefully show how they go together, just like we did on the thoracic limb. We'll stack them out, and we'll show what they look like on the pelvic limb as opposed to the thoracic limb. And the one other difference is the pelvic limb does have a ball and socket joint. You can see the socket right here. Right here. That's the socket. The ball is on the femur, and the ball is right here.